just want to kind of get an idea of like what your level of engagement is with your current mental health benefits in general, just to get an idea of what people are and then how people access them, because there's a lot of ways to access them. That's going to help just to set up and understand who you are and where you're coming from, so that we can be able to tailor the presentation to you. So if you don't mind answering those two questions to start off with, we'll be able to share the results afterwards as well. Some of you might be able to see them as well. So if you don't mind just taking a minute to answer those two quick questions as you have, and if you don't have all the data there, no worries about that. We want to help you ask more questions as a professional. That's the goal of this webinar, so that you can be more informed and be able to make even more strategic decisions around mental health well-being for your organization. So I think that we've got some poll results still kind of coming in. So I think a few more maybe coming in as we are. So I think that I'll give it another 30 seconds.
And Austin, I'll just
as we answer here
really quick, just because I saw the question come up. We won't have the standard chat function available, but you can utilize the Q&A and we can answer those questions as they come up.
Yes.
Live or by typing a response.
Please, yeah, use the Q&A feature, please, if you will, for that, so we can be able to share your question out with everyone too. So thank you for asking that. Chat is for technical support by all means, or if you just feel like reaching out to me to say that you're happy to see me, you can do that too. So I'm happy to see all of you. But I know that we have a lot of friends on the webinar today. So I think that that's great on the poll there. Thank you for this. Looking through the results, looks like percentages of utilization currently offered. There's a decent chunk that they're not sure what their current numbers are for sure, but it looks like in the 2 to 4%, maybe 4 to 6 is where a lot of people are, maybe up to 8, which does trend with national averages around the 3 to 8%. Utilization is measured by a lot of different organizations, different ways. So understanding what that looks like for your organization and asking more questions is going to be important for you. And then how your benefits are offered. Looks like the leader on that one is through an insurance provided bundle. Disability, life, medical providers that you're accessing additional mental health benefits through. We have about 25%, a little less, that are offering more than one, which is, I think, a beautiful strategy. We'll talk a little bit about that and how effective that can be to give some choices. There's a few people that aren't currently offering, so I'm glad that you're here to join as well. And we got some standalones. So I'm going to end the poll on that so we can get going and have a rich conversation. Sharing the results of that. I think I maybe already clicked on that so you could see them. I'll share that real quick as we get on. And so you can see there the results of every one of your peers that are on. Thank you for answering the questions, just to kind of give an idea of how everyone's trending. So you can see those answers there, and we'll distribute some more info at the end if you'd like to see more details on that, if it's relevant for you. Just reach out and let us know. So as I have here, I'm going to stop sharing. Just give me 1 sec. All right. So diving in, we're going to talk about the state of mental health and overall. We're going to talk about some of the impacts on the workplace, some emerging solutions that are out there, and then we're going to go into live Q&A. And so if you'll bear with me, I want to go through some statistics that I collected for this presentation to set up a conversation. And then I want to get into interviewing both Rett and Kyle, just to let you understand and hear from a few people in the space around their perspectives and get a chance to ask some questions. So the Q&A on the Zoom banner is where we would love to have your feedback, please. And if the other moderators on here, if you see questions we want to answer, just help me raise the hand as well, as I'm driving a few things here. So feel free to do that. So if you look at across the United States, from the State of Mental Health Awareness in America report in 2023, around 21% of adults are experiencing some sort of mental illness type of issue, and around 5% are in the severe category. In terms of, this is post-pandemic. There were spikes certainly during the pandemic, and a lot more awareness, which I think has been a bit of a hidden blessing out of this. And so with the things that have come out of that, what we've seen is a persistence that has remained higher. But at the same time, some of the other statistics around that are what we want to talk about, not just the prevalence, but how people are accessing care. When it comes to the access, around 54% are not receiving treatment still. And so that leaves a number of individuals who perhaps are going untreated, through the mental well-being system care. Maybe they're, maybe they're doing something else outside the system, but there's about half of people that are not really receiving treatment right now. So there's still a big gap. We're here to talk about reimagining things to try to make that gap up today. When it comes to where people live and where the providers are, there's projected shortage of over 500,000 providers in the next 10 years. And that's from the HRSA Behavioral Health Workforce Report. And around 50% of the population lives in what's considered mental health professional shortage area. Telehealth options certainly are helping with that to some degree, but for some of the in-person visits, as I've had friends and personally experienced, sometimes it's very hard to find a way to get in and to see the person that you want to see. When it comes to HR professionals, more than 94% of you surveyed, this is by Headspace, feel an increase in responsibility to improve your company culture, supporting mental employee well-being. And when it comes to the individuals in your organizations that are feeling stressed out most of the time, it's the Gen Z women and men and millennial men and women especially that are having a much higher prevalence of need. And you can see that need persisting over the past 4 years as well. And that's from a Deloitte report, which is a very excellent report as well. When it comes to some of the concerns, what's contributing to some of those concerns, if you look at job and workload from poor work-life balance, Gen Z millennials have very high prevalence of really reporting and surveying around these factors from work environment, team culture, and the things that are contributing to anxiety and stress, are pretty well documented at this point. But when it comes to utilization, so you have different things that are designed to help people take time for themselves, from vacation and time off, the regular catch-ups with managers and great communications. Really, when it comes to some of the support in other areas, there's still a decent chunk of individuals that maybe know it's offered and it's used, or maybe they don't know it's offered, but it's not used. And you can see the disparities there between some of the areas of offered but not used, amongst various generations from Gen Z and millennials as well. And so you have a number of people that are not fully utilizing the current benefits there, which does beg the question about reimagining some of the things that are going on in terms of what you're providing. When surveyed with LIRA, 65% of the U.S. workers said the mental health challenges interfere with the ability to work. More than 20% with burnout and depression being reported out there as well. As we continue to see that has persisted, in our workforce, and it continues to grow, especially amongst our younger workers. When it comes to the workforce, this is SHRM research. Over 59% of the workforce say that too few resources are offered when it comes to the current mental health benefits that are out there. And when you look at the things that they're interested in, going deeper in the research, they're looking for more diversity of offerings, from mindfulness and yoga to other alternative apps and services, from support groups and training. They're looking for culture, mental well-being in a lot of ways as well, even workshops and educational resources for them to understand how to educate themselves and others. When it comes to satisfaction, this was a little bit disappointing statistic around benefit satisfaction overall, with cost trends continuing to increase and benefits sometimes being reduced. All those hidden paychecks, keeping that up for employees to realize that. The fact that this is the lowest point in the past decade, certainly we know that we have a challenge always in front of us with open enrollment coming up around communicating that. The employee perception care gap is another interesting, statistic that's tracked by the MetLife survey. And it really shows that really 88% of employees say they're feeling that the employers are saying they're feeling they demonstrate care, and yet the employees are feeling cared for. You have a gap in that. And that employee perception gap and care persists in other areas as well. And really, a lot of the causes that are really causing poor mental health among employees, financial and stress outside and balancing things, continue to be at the top of some of those trends over what are the causes of it. Going deeper in the MetLife survey as well, a lot of the external research really validates that employees who consider workplace well-being as important as salary, as it did 93% over 2022, up by 10 points. And if you look at also employees who consider even leaving a company that doesn't focus on their well-being, 87%, that if they don't feel that there's a culture of mental well-being and proper supports, but also on the other side, percentage that would stay from people that are doing it right and well, it really is does highlight the importance from a retention standpoint for you as an employer in communication and engagement. When we look at the mental health crisis, more than 90% of the public think that there's a mental health crisis today. Certainly, as we were talking about before the call with elections and all the news cycles and things like that out there, people are feeling certainly very intense pressure in a lot of ways and very uncertain. And really, the feelings of anxiety have continued to persist. I read a book around that recently that we'll talk about as well, around some of the statistics with anxious generation. But there's a survey from the Kaiser Family Foundation around that. And if you look at some of the workforce attitude surveys as well, looks in terms of HR leaders that have taken advantage of mental well-being, unfortunately, we need to take our own medicine as professionals. And so I want to use this slide as a call out and a call to you to make sure that you're taking care of yourself in this as well, whereas it shows that CEOs and employees are using it more regularly in terms of comparing the three. But still, the surveying is showing much lower utilization in those numbers, just comparing them to each other in terms of who uses them. When it comes to employees, they're worried about cutting back with benefits. Your CEOs really are reinforcing that they wouldn't do that in the midst of other crises that are out there. But with people having looming fears over financial issues, people do get concerned about cutbacks that rely on those benefits. And so reinforcing your employees around your commitment and why you're doing this is important. But I think that most startling, the leave trends that are out there for mental health related leave, a 33% increase in leave related trends related to mental health versus term research. And MGIS and disability, turning into disability claims, is now the #1 cause of disability in the United States today. And so all along, the EAP or the other utilization statistics have stayed relatively flat with some inflection, but yet leave and disability trends, pharmacy trends, and other trends are showing that we have a lot of unmet need, is what we're seeing really across the board. And so when it comes to congressional action, if you're not looking at mental health parity and looking at those different various rules and things, National Association of Business Insurance Professionals recently championed work around this as well. So really looking at mental health limits and looking at different other areas. I especially want to just do a call that if your disability benefits are limiting these areas, you might want to look at rethinking that type of benefit in terms of your values and the cost there. But there's mental health parity among other areas as well. And so it's a trending topic we're going to go deep in today, but it's hitting the regulatory side of your plans is what I want to certainly point out. In terms of the landscape and the diversification of different options out there, we're going to be interviewing a few people here to talk about this as well. But you've got, communication apps, you have training apps that are all about training, maybe self-service. You have some on-site services that are actually being pioneered in some organizations going well. You have employee resource groups, other app-based therapies, and then you have traditional EAP. So you have certainly a diversification of some of the types of offerings that are out there and the way that they're accessed. And we're going to be talking about what those diversifications look like with a specific example, having a chance to interview Rett Kearbey, who's the CEO and founder of Sholder, having the opportunity to work with Rett over the past year and understand more about their business and have a lot of conversations with people with him. And I think Rett's mission and founding the organization is incredible. His background comes from leading strategic work with Apple, with the iPad release, to working with well-being organizations in the world that are leading in their areas. He has a really diverse background. He's also, if you didn't hear earlier on the call, a classically trained singer, an incredible person, and really a very mission-driven leader of Sholder. And Sholder is short for Spaceholder. And Rhett's going to tell you a little bit about what it is. So we can interview him and you can have a perspective of his background. But I'll hand it to Rett and just tell me when to advance your slides, Rett, and I'll work for your notes on that. So take it away.
That sounds great. Thanks, Austin. And thank you, Cynthia, and everyone for your support in putting this event together and for everyone attending. Let me just start by giving a quick background. Sometimes it's important to hear a founder's story, why they started something. I studied pre-med in college, and I was made aware very quickly that healing is different than our healthcare system, even back in the year 1999, 2000. And we've now seen that the US is spending twice as much as the average comparable country on healthcare with some of the worst outcomes. And so I switched to business, and I had a 20-year career, over 20-year career in business, but I've always had a passion for seeing people healthy and whole and balanced. And when I was preparing to turn 40, I took a break. I was focusing on just noticing how polarized our world was. Mental health crisis was a common phrase. And I felt drawn to figures who had helped humanity remember who we were at different times, people that had made a real difference to bring us together and move forward. Martin Luther King Jr., Thich Nhat Hanh, people that had helped lead peaceful revolutions. And Mr. Rogers was one of these figures that really came into focus for me. You know, someone that helped normalize the language of emotions and the inner world for children and for adults. And, you know, there was about an 18-month process where I just did a lot of soul searching. And as a part of that, you know, process of trying to figure out what I wanted to do next, I had a conversation with one of my friends, Will. And Will is a Harvard psychiatrist. He got a PhD from Oxford. And he says he climbed the ladder of Western mental health. And when he got to the top, he couldn't heal himself. And that really struck me. And I asked Will, do you think that empathetic people in our culture, people that want to make a difference, do you think they can be trained to provide outcomes-based care for mental and emotional support without having to go through years of formal training? And he said, not only do I think this, the National Institutes of Health has been studying this for the last 15 years. And so he sent me a bunch of research. Ultimately, that led to Will becoming our first advisor and helping me assemble a council of great mental health professionals across the landscape. Over the course of about 18 months, we built a custom methodology and training that we now train. And this is, you know, kind of bringing us to this slide now that's in front of you. At Sholder, what we do is we train empathetic people to provide transformative non-clinical support through a relationship that feels just like a friend in their phone, an organic support relationship that is outside of the healthcare paradigm. There are no notes taken. There's no medical tracking. We can get into some of those questions. A lot of people kind of flag instantly and go, wait a minute, there's some questions related to that. We work with some of the most brilliant attorneys, the largest law firms in our country, making sure that we're keeping our nose clean there. I can feel some of you asking these questions right now, is just why I'm sharing this. But to stay focused on what we're doing, and I think what's needed right now in our world, the peer support dynamic, not having a power dynamic, is allowing for us to reach many, many people who said, I never would have talked to a therapist. I never would have sought someone to connect with. We're able to provide on-demand same-day sessions and at a radically affordable cost with really tremendous outcomes. So if you advance to the next slide, Austin, I think this is a really important just kind of context. We talked about this briefly, but the great paradox that we're living in is never before have we been so interconnected through technology. And yet our brains have been rewired, attention spans are shorter, and we're feeling more disconnected and isolated than ever before. Loneliness, the US Surgeon General has said, is now the #1 driver of many health and societal problems. And even pre-pandemic, a large study was done, and over half of the US citizenry said there's not a single person who really knows the real me. So this was a problem going into the great separation or the great isolation event that we all experienced. And it's only been exacerbated since then. So if we go to the next slide, just a quick understanding of some of the drivers of this. Why aren't people getting the support they need? What we see, traditional EAP utilization, and I think the poll that Austin did at the beginning of this call reflects this. Typically 3 to 5% of people are utilizing those standard mental health benefits. And yet we show 89% of the workforce reporting burnout at some point during the last year. So if we go to the next slide, a few things are driving this. Fear and stigma. We all hear the concept of mental health stigma. What does that mean? Well, it really breaks down into a variety of different issues. People have a hard time admitting there's something wrong. This is part of our self-defense mechanism. To admit something's wrong with us, it feels kind of antithetical to feeling okay. We all want to feel okay and believe that we're okay. So, admitting that we're broken, finding out that, and by the way, we don't believe that anyone's broken at Sholder. Will my employer find out? Is this on my record? Will I be diagnosed? How is the data tracked? This is becoming more and more important for many people with the rise of AI and the understanding that, Siri is listening to everything we say, right? We're all aware of the nature of the world we live in. Access is another big issue. Who am I going to connect to, and are they going to be the right person for me? There's a provider shortage now, and there's a forecasted provider shortage, as Austin covered in one of the slides earlier, of over 500,000 providers soon. So even when you get connected with someone, do they have the cultural competency, the ability to connect with you on your level? And then the financial aspect of this is that the incentives aren't necessarily aligned. Most mental health benefits that are offered are structured as insurance products. And an insurance company, when they pay claims, it reduces their profits. And so the more people use, if you consider submitting a glass claim to your car insurance company every month, it's going to be a certain amount of time before they're not excited to have you as a customer anymore. And so we want to make sure that the financial incentives actually are aligned with people getting healthier over time. If we go to the next slide. To that point, non-clinical access to a non-clinical person is now critical, and it helps people get around this stigma of necessarily having to talk to a therapist. About 75% of people who are connected with a clinical therapist actually aren't having a clinical level event, which is really important. Many people are going through the emotional highs and lows of life. And so giving people access to a stratified offering, something that falls below that clinical level, that's a lot more affordable, flexible, in the moment, that feels like a friend, we're seeing it being vital to workforces. Again, how is personal data and EHR records, these records, how are they tracked? Diagnosing and treatment plans are important if you want insurance to pay for those healthcare interventions. And clinical healthcare and clinical mental health care has a very strong place in our society. When that's needed, it needs to be there. Right now, there are many people that are getting escalated into that tier of support that are getting diagnoses that don't necessarily, to a hammer, everything looks like a nail. And if you need a diagnosis to continue receiving treatment, that's what's going to happen. So we want to provide an offering that people want. That's the whole focus of what we do at Sholder. The authority and power dynamics and the peer-based relationship with proactive check-ins is another great differentiator. So continuing on, just to help visualize, we're falling below that clinical level, but above a self-help tier of support, watching videos, using a meditation app like Calm, talking to an AI chatbot. These are some interventions that are coming at this lower level that can be very helpful for self-help, but there's really nothing effective right now between that level of self-help and clinical intervention, and that's where we are. It's a standard gig economy, two-sided marketplace. So a lot like Airbnb has a host and a guest. We have a shoulder and what we call a sharer. Go ahead to the next slide. A few things that happen in a session, just to help give you an understanding of how our shoulders are trained and some of the things that happen in an active one-to-one therapeutic intervention. Active deep listening, co-regulation, somatic inquiry or embodied exploration, helping people experience themselves from a place of awareness and notice the feelings that are arising in their body. One of the things we kind of joke about, but it's very true, is a 2 or 3-year-old child knows exactly how to clear negative emotion from their body, and they will do it right in the middle of the aisle of the grocery store, whether you like it or not sometimes. And as we get older, we stuff our emotions. We are conditioned to behave in an acceptable way societally, but it doesn't mean that we're not having to pay a price or navigate those things. So having a safe place with a skilled person to process these things, to understand how to get into our bodies and to experience ourselves from a new perspective that is empowered is a critical piece of what we do. And some common outcomes, as you can see here towards the bottom of the slide, these are common ways that people experience themselves after the sessions that we deliver. Go ahead. So I'll share just a few quick stories. I don't want to take too much time, but I think sometimes it's helpful to understand a real human life and how it's touched. These were volunteered from people that have used our service over the last year and a half or so with their permission. There was a school teacher in one of our customers is what we serve a few school districts. This teacher specifically felt frozen in making decisions, and that started to affect how she would behave in the classroom. She started feeling disconnected from the students, from her family. And of course, as many of us do, she started judging herself for this, which just compounded that issue and made it feel more intense. In her first session, she did a pretty big somatic release. And we can, I'm happy to answer any follow-up questions about what these things are. She was guided in some anchoring techniques. And as she started to embody these practices and talk with her shoulder, the frozen feelings largely evaporated. And what could have very easily been pathologized could have, actually turned into her own navigation of her emotional state consciously. And she's relying now on her body and that intelligence and wisdom. Her coworkers have started saying how much more joyful she is. So she's getting really interesting feedback from her coworkers. And in her words, she says that she's rediscovered part of herself. And this process was about 3 months of weekly sessions with her shoulder. And she now has monthly check-ins for balance. And so just kind of staying in touch for what we call emotional hygiene, regular check-ins. We worked with a fast food worker through our nonprofit, actually. She was referred through a person that was using the service through their employer, and our nonprofit covered her sessions. She was in an emotionally abusive relationship, and she paid for the first 3 sessions, but she couldn't afford it anymore. So that's when our nonprofit kicked in. She got pretty clear within the first few sessions on what was best for her and made a decision to leave that relationship. After now, when we checked in 10 sessions in, she had removed herself from the relationship, been transferred to a new location with the same employer, this fast food restaurant, and had found a place to live, for herself while kind of couch surfing. So she went through a pretty big ups and downs, but had a skilled relationship that was tracking with her through that process. After 20 sessions, she had tested for her GED. She had moved very quickly, and she was on a management track at work. And the reason I wanted to highlight this one specifically is a lot of times when we don't have someone that believes in us, that has the level of emotional presence and skill, when that relationship comes into our life, it can really make the difference with how we see ourselves. And, I want to be sensitive to time, but the HR leader, I know we have HR professionals on this call. This is an HR leader at a very large retailer. And this person started working with a shoulder around just basic triggers that would come up at work with coworkers. Pretty quickly, she transitioned into some deeper work around what she wanted out of her life. They had a young child, she and her husband, and she brought her husband in to start working with the same shoulder. So they were able to do some couples work together. And after about 7 to 8 months of connecting deeper with themselves and each other in those sessions, they decided to take a hiatus and sail around the world with their young child. And it created this amazing new opportunity in their lives. They chased their dream. They went into a sailboat, and they were keeping in touch with their shoulder as they were going around the world. She's now back at work with the same employer, having had that moment. And, the reason I bring this up is it just shows that, in our lives, so many things are possible. And when we start paying attention to our lives and we have someone that's skilled at helping us do that, all kinds of new awarenesses or possibilities start opening up for us. And that's how we train our providers, is to be attuned to what's emerging in the person they're serving. So that hopefully will give you just a very cursory flyover of some of the experiences people have when they connect with one of these relationships and what becomes possible for them. Overall, we're looking to boost resilience and stability in the mental and emotional dimension of the workforce. So, and that starts at an individual level with each person. Go ahead to the next slide. And I want to wrap this up just with a gift. For those of you who have made time to join us, I'd love to invite you to experience a session absolutely on me. Many times we can understand something with our minds, but everything changes when we experience it for ourselves, when we have experiential knowledge. And that's what I'd love to offer you, is the opportunity to have an experience with a shoulder. Something is always emerging. For everyone on this call, something's always seeking to express for your best interest. And this shoulder session, if you take me up on it, we will cover the cost of it. And it could start with an issue or a problem, but it doesn't have to. It could start with just a curiosity in your life. It could start with a desire or something that you've been wanting, or a possibility. It can start from any place. It doesn't have to be, I need help with this, right? So if you want to take advantage of this, please, anytime over the next week or two, go to sholder.com. That's shoulder without a U. And you can click get started. Just mention this webinar to the coordinator, and we'll get you connected with a shoulder on me. We'd love to invite you to observe your life in that way and give us a chance to serve you. So I appreciate the opportunity to share what we're up to, Austin, and I'll hand it back to you.
Thank you, Rett. Appreciate the gift as well. That's very kind of you to do that. I was unexpected, as you mentioned that the other day, to add it. And I think that I hope that if anyone wants to take advantage of that, I think it's a beautiful gift to give to the HR community that I know is probably getting ready for Q4 and a lot of things that could stress. So that's a really, really kind offer. I think that I've had a chance to meet a lot of different providers over the years, and brokers and consultants, and always love to just find a kindred spirit. And so as I get a chance to introduce Kyle, I just want to tell you, I see you, and I'm so excited to have a chance to just hear your perspective. I thought that it would be fun to structure this webinar to hear from both a provider and a consultant, and just to have a conversation, and hopefully we can have great time to get to Q&A to do that. I know you've got a few words to share just around like why you have an interest from a consultant standpoint, mental health and well-being, and some of the questions or thoughts that people should be asking, no doubt. But beyond that, just to give you a proper introduction, the vice president at Summit Financial Group, really working with a lot of various organizations across the country. But beyond that, in terms of your education from an MBA in healthcare administration, I know that you've really worked with a lot of organizations from all walks and their executive team members. But you've had a long career like me, 26 years in HR and benefits for myself. And I know your career, you've worked with a lot of leading organizations, and we'll have your full bio sent out. But I did want to just call out, most importantly, that Kyle and I are going to be joining each other sometime soon to cook together, because he's an incredible chef. And I'm so excited to get my smoker out and do some fun stuff with you. I know that all your work in Texas, we might have differences between Memphis and Texas in our barbecue, but I know that we share the same values either way. But other than that, please welcome Kyle Minick to just share a little bit about what you do with Summit in general, just to give a background for what you do. But I know that you want to just talk about mental health too. So I'm going to hand it to you, and just tell me when you want me to advance your slides. I'll start with the first, so you can just tell people who you are, please. And if you have questions, drop them in the chat. We'll work to type them, and then we're going to have a whole section for Q&A. We'll open it up for you. So go ahead, Kyle.
Well, I really appreciate the kind introduction, Austin. I'm not sure that I've attained equality status with you with a 30-year HR career and insurance consulting, but I do appreciate that. But in terms of cooking, as long as you don't try to take the brisket from the Texan, I think we'll be all right. but the
I'll leave the brisket to you.
I appreciate that. So, like Austin said, I'm the Vice President of Employee Benefits Consulting here at Summit Financial Group. I lead our Texas practice. We are a national firm with we've got 12 offices around the country, although I think we've slimmed that a few times because we sold a TPA. But we really focus on three things, right? And that's benefits, insurance, and investments. Benefits is also the obviously the topic that we're here to discuss today, but commercial insurance really functions around that property and casualty, commercial lines, general liability, and then investments focuses on that 401k side. We really have a broad range of clients from when it comes to size. Our smallest client is 2 employees. Our largest is 15,000. So we really run the gamut. We see the different strategies that are out there in the marketplace at large, particularly as it pertains to those medical plans where you have mental health benefits incorporated in it. You have to, pay attention to things like the mental health parity legislation that came out of Congress, but even down to that 2-employee company, it's really important to understand where your employees are and giving them the things that they need to really take care of themselves, right? Because there's a real cost associated to not having them in there. And not having those benefits that are oriented around not only dealing with the body, but the soul and mind as well. Let's go to the next slide. And this is just a little bit of our mission statement. We're oriented and really built and believe in crafting strategies that fit the employer, right? It's not about us. It's not about our favorite place to go. It's not about our favorite carrier. We try to stay agnostic and are committed to being principled and innovative within the employee benefits landscape to ensure that the best-in-class strategies are on the table, but that those strategies are oriented around your needs and your employees and what they need, right? Because at the end of the day, that's what benefits are. Benefits are not about just attracting and retaining top talent. They're about solving employees' problems or issues or needs within their life to address things like their finances, like their health, like their mental well-being, like their family's well-being, so that all of those things orient them and make them feel like they're taken care of when they're in your employ. All right, so I just want to touch on a couple things here on this next slide that I think are relevant to the conversation that we're having today, particularly as it relates to the mental health conversation and benefits at large and how they affect us as employer groups. Let's go to the next slide, please. So the first thing is something I think we all know, right? The employer-employee relationship has drastically changed, right? 20 years ago, if you said that you had a medical plan, that was all you needed to be able to attract and retain some of those key employees, and kind of get your job postings separated from everybody else. But that's not really the case anymore. Ever since COVID, it seems like the shift has gone towards the employee. The employees are the ones that are really yelling and speaking the loudest about what they need to be, employed or to come to your companies. And I think the employer community at large has really responded to that by orienting themselves around things like the work from home conversation. Do we want to have a hybrid environment? Is it full-time in the office? I'm not advocating for anything on that space, but it highlights the nature of how the employees in the job market are asking for what they want, right? And it's up to the employer to decide whether or not they're going to respond. But frequently, I'm seeing more and more in these conversations that the employees really are holding a lot more of the power when it comes to what employers need to offer to be competitive in that labor market. And then we've seen a lot of statistics today, but I want to highlight 3 in particular, and that's 75, 60, and 50. 75% of large employers offer mental health services, right? Separate from their medical plan. But only 60% of their employees have ever used them. Or excuse me, 60% of those employees have not used them, right? So that's the majority of employees. Majority of large employers are offering the mental health benefits, but the majority of their employees have not used them. And 50% of employees would prefer telehealth as a form of mental support and mental health support. So what is that really what are the takeaways from those numbers? It says that medical plans and EAPs are not enough, right? And I think Rett and Austin did a good job highlighting why that is. You cannot have mental health benefits that are solely clinical because of things, right, wrong, or indifferent. The stigma surrounding receiving a diagnosis, the fear that comes hand in hand with that, not wanting your employer to know that that's happening, right? Or any number of other litany of reasons are all relevant to the fact that employees are aware that they have these things, but they don't use them because they're afraid to take that next step. And when we're looking at the continuum of care, right? And I think that slide that Rett showed was a phenomenal example. There are self-service methodologies, right? And then there's clinical methodologies, but there has to be a bridge between, right? So how do we build that? And I'll kind of talk about that in a minute, but I also want to highlight the real cost of this, right? From a benefits consultant perspective, right? I'm looking at employer claims a lot, and we're evaluating strategies that we can leverage to drive those claims down to help manage those employer premiums in the benefit program, right? Well, $44 billion is in productivity are lost to depression, right? That's a huge number because depression leads to what? Absenteeism, cultural damage. When you have that employee who is really struggling and not receiving the care, sometimes that can bleed out and affect teams and their culture and how people are approaching the workplace, right? But even more so, we want to focus on that mind-body connection, right? There have been a litany of studies done that show that when your mental health is suffering, your physical health follows, particularly in situations where you have longer periods of untreated mental health or not necessarily diagnosed, but unaddressed things happening in your life, whether that's depression or stress or anxiety, or even simple things like confusion that then kind of graduate up to those higher level issues. So what do we do about that? We have to walk the path. And what does that look like? We start by treating this like I said, a continuum of care. A lot of you are in larger organizations or are applicable large employers, to use the nomenclature, and you have evaluated or at least understand the difference between a fully insured plan and a self-insured plan, right? And on the left hand, you have that fully insured plan. And on the right hand, you have the self-funded plan. Well, there's a lot of things and innovative strategies along that path that you can leverage to control outcomes and affect claims and affect employee outcomes, right? And so it's really important to treat mental health just like that and understand that every single step you take down that pathway helps you to address some of the outcomes for your employees and your claims, as well as the productivity within your own office. So we have to be, as HR professionals and consultants, we have to build that bridge between the employees and the care that they need, right? I think all of us in particular are hyper aware of the regulations around HIPAA and how there's a fine line that we have to tread when addressing some of these issues that employees have. But I want to remind all of you that at no point will you be in violation of HIPAA for asking your employees, are you okay? Are you getting the care that you need? Because that is a conversation that not only makes employees that are struggling feel cared for, right? But it also gives them an opportunity and gives you an opportunity to drive them towards the programs that you are offering towards them. Like I said, 60% of your employees have not used the mental health programs that you have. And I can almost guarantee that for the majority of you, if you look at your utilization reports, that number is actually going to be a lot higher, right? So how do we bridge that gap? We have to build the bridge. We have to remind them and do education about some of these programs. We have to leverage non-clinical and clinical strategies to make sure that they have access to care across a broad continuum, right? And you have to have a conversation with your consultant, right? And get that utilization data not only within your medical plan, but within your EAP, but then say, okay, if we're not meeting our objectives here, how do we roll these things out? How do we educate our employees? Can we do health fairs or education meetings, or is there a monthly newsletter we can send out to our employees that highlights mental health strategies and things that don't necessarily involve going to a psychotherapist and being told that you have depression and prescribed 5 different things? That's what employees are afraid of, right? Letting them start that journey and start that conversation around their own mental health at a non-clinical level gives them an opportunity and gives you an opportunity to control that productivity loss, to control that mind-body connection for your employees, and to help them take the first step they need to take in order to get healthy and be the best person that they can be within your own workforce.
Well, thank you, Kyle, for sharing your heart around what you're doing and how you're doing it. We're going to be jumping into Q&A, and I think that your statistics around the 76, 60, 50 are so compelling around what individuals need to be thinking about. And so this presentation is designed to just help you ask different questions, help you reimagine some things. Cynthia's going to pop on to help us moderate the Q&A. We've had a few questions we've already answered by typing. You're welcome to ask whatever you like, please do. But I just want to thank Kyle and Rett in advance as we'll close out with that as well. Thanks for sharing what you do to give some context. We want to just expose you to just some different thinking and different ideas around programs. And Rett, so kind of you to offer a session on a Sholder. I think that's really an incredible, very, very nice gift. So thank you for that. Cynthia, do you want to try to lead us through the Q&A and any questions that have come up? I think you might be muted as we're getting going.
There we go. Can you hear me now? Yes?
Thank you.
Yes, ma'am.
Okay, good. Okay, Maria asked about peer support. The peer support model from Sholder sounds intriguing. My concern would be, how do you be sure that those relationships, this is a good one, stay professional and don't cross boundaries?
Yeah, thank you so much for the question. One of the very critical skills we teach to all of our Sholders is self-management. And that's a blanket term that actually has a lot of nuance. So it is a core part of the training we deliver. It's one of the 5 pillars of what we call shouldering, or to shoulder someone. We also have agreements that between the company and each provider that dictate, how they deliver care. It's a set of agreements. We also have an active community where all of our qualified providers that are delivering care are active in an online community, and we have regular events weekly with ongoing education. We do quality assurance tests. We have a lot of different protocols in place to ensure that the relationships stay professional and don't, overstep boundaries. What I will say is the feeling or the sense that another human being is considering us, holding us in their thoughts. Some people use the language praying for us or setting intentions with us. That feeling is something that is offered through our service. And that's something that does, people could argue it does blur that line between kind of a friend and a professional service. Yeah. The sense of closeness or proximity to that relationship, the sense of truly feeling cared for and feeling held is something that we don't shy away from. We want a human-to-human connection in this age of the rise of AI. And so we do have many different things in place to guarantee that, that it does stay professional in the delivery of care, but we also really lean on those relationships.
Well, I'm just curious. So if we have, what if we have someone who really takes advantage and calls like every day? They're having marital problems, for instance. And
yeah, so we haven't had this issue yet. It's one of the things that we've thought of quite a bit. If someone's in that type of place, first of all, we all have busy lives. And, in imagining a possible scenario, we can create many different thoughts in our minds. What actually plays out in real life, for someone to be leaning on their shoulder every single day, one of 2 things is happening. Either they're in a really difficult cycle and they truly do need that support, or they're not managing their own time well and don't have other things that are keeping them busy, or don't have a life, or some of those types of things, which might indicate some other issues. And so what we would be doing in that session, we just meet people exactly where they are, and we support them in moving forward with what's emerging for them. So if that heavy of a need started to occur, the relationship with the shoulder is actually designed to move them back out of that into their own power. So empowerment is another key skill that we teach our shoulders, of how to empower someone, get them back at the center of their story, and start moving forward on their own terms.
Great. I'm thinking about thinking of my experience as an HR professional, 33 years, how people would come to HR and talk to us about their personal issues, except for one thing: abusive relationships they tend to keep to themselves because they're afraid that their partner will harm them if they tell anyone. And how do we handle this? Because I think this is a great reason to have Sholder. Can you refer them to a place where they can go, or do you just listen to them and hope nothing happens to them?
If anyone's in danger, we have escalation protocols, and we have ways of determining that have been crafted with some really brilliant mental health professionals across the landscape. So we actually have very clear escalation paths and protocols if those types of situations arise. So that's something we're equipped to do. I wouldn't necessarily be bold enough to give guidance to HR professionals as to how they should handle it in their own workplaces. I think that's a great question that, I'd encourage everyone to seek out the best solution for yourselves. What I can say is we've been piloting with a few HR leaders in our customer base the ability to flag an employee if an employee comes into the office and they're discussing something, to be able to say, we have Sholder available to you. If you're willing to connect with someone, it's non-clinical, there's no records, I can have them reach out to you to schedule a time to connect. And what we've noticed with that, Cynthia, is the people that wouldn't necessarily take the first step themselves are extremely grateful when we just reach out to them and say, hey, with your permission, we were asked to just get in touch with you to schedule some time to connect. Every single time this has happened, we've been met with deep gratitude, and it's been a great experience. So we haven't formalized this as part of our process yet, but we're experimenting in these ways because we want to help HR leaders not have to be the shoulders that often you are in the workplace, because there is a professionalism boundary, and you're not employed to be a therapist or even a shoulder.
We are.
So we're experimenting with ways to help you move that energy over to something that can truly support that person, while also staying in your strength and
well, and this is also exactly what I was referring to at the end of my presentation.
Go ahead, Kyle.
Right. The idea is you're not in violation of any sort of employee-employer relationship or HIPAA or out of line in any regard by saying, hey, we have these services for you. Right. And I see it dealing with HR professionals a lot. You're absolutely right. They feel like therapists. They're dealing with the problems of their employees that are extending beyond the workplace. So it's important that HR professionals remember that they have the right and the ability to refer their employees to the services that they're offering, no different than a medical plan, right? Or a dental plan. When an employee comes to them and says, oh, I've got a toothache, you don't have any problem saying, hey, you're enrolled in our dental insurance, you should go see a dentist, right? In the same context, when people are having these issues or problems or struggles or stressors or whatever the appropriate nomenclature is for that specific item, you as an HR professional have the ability to refer them to the services that you're offering and say, hey, we have non-clinical methodologies for you to be able to, talk to somebody, or do you want to talk to somebody, or can we have somebody reach out to you on this item? And you're not crossing any boundaries there from a legal perspective by saying, hey, we have these things for you.
I think, Kyle, thank you for the clarification, and Rett and Cynthia, thank you. We're at 60 seconds, and we have 2 more questions, which we may send out and send you emails about. But I think that any solution should be validated with data and also should be validated with the incentives for their performance. understanding how they're structured. And so thank you, Chris, for your question around that. Looking at the incentives, Kyle is so good at that. You know, what are the incentives for this provider? How are they structured? How's your plan structured? And how do we do things? So thank you for your question around that. I know that both are dedicated. I can't go deep on that. But escalation, I think, from what I've heard from Rett, talking with them, has been a very core part of what they would do, and a very important part of what is important to them, because there are people that might find an inception point, you know, right, with a different service, and being escalated to the right service is very important, not from a value standpoint and from doing the right thing. Beyond that, I know that you have protocols for that. So I'll kind of cursorily answer those questions, but I want to turn it back to you, Cynthia. Kyle and Rett, thank you for the conversation. You're going to get an email that's going to have the HR information that you want for your credits. Thank you for your attendance. You're going to get a PowerPoint deck that you can save for yourself, and links if you want to follow up with Kyle, learn more about Summit, as well as take advantage of the very kind offer that Rett made, which I was just so pleased to hear. Cynthia, you're an amazing host. Do you have any other announcements? Thank you for all the attendance on the call. I appreciate y'all's time today.
Well, I just want to invite everyone to attend my personal webinar. That's going to be the 27th on Friday of September. And my topic is going to be planning your 2025 benefits, your total rewards strategy, if you will, for 2025. So I hope you can join me. Watch for your invitation. Thank you all for attending today, and thank you guys for this excellent presentation. It's really something we need in our organizations, and I think you're going to just do a great job with it. So thank you so much. And we're going to have another one next month, Austin? Yes, we will be talking about the 99%. So for those that got a chance to talk today, we'll continue the conversation talking about alternatives and options. And we're doing that with one of our dear friends. So you'll get some invitations on that as well. And that'll be October 8th, I believe. They're just doing things different. So we'll have a chance to interview Rett further, but also to talk about some other different options for communications that are really amazing. Kyle, thank you for your hosting and your great clients that are on here. I know that they were happy to hear from you as well. So we're going to close it out. Appreciate y'all having us and for letting thanks again, everyone. So watch for your email invitations, because there's more webinars to come. Thanks, everyone. Have a great day. Bye, guys.
Thank you.
See you.